Comment your name and state below. I'd love to see who's watching and benefiting from these videos. And as you're listening today, just remember, this isn't about fear, it's about understanding how Medicare really works behind the scenes so you can make smarter choices for yourself and your family. Let me start with a picture that probably feels familiar to some of you. Imagine a small hospital sitting on the edge of a rural town. It's not fancy. There's no giant glass building, no valet parking, no big marketing signs. But it's the place where generations were born, where broken bones were set, where heart attacks were stabilized, and where neighbors show up to take care of neighbors. Now imagine that hospital doing everything right, treating patients, filing claims, following Medicare Advantage rules, and still waiting weeks, sometimes over a month, just to get paid. That waiting isn't just inconvenient. For many rural hospitals, it's the difference between staying open and shutting their doors. That's why a new pilot program from UnitedHealthcare is suddenly making headlines across the Medicare world. Quietly, without a lot of flashy advertising, one of the largest Medicare Advantage insurers in the country has launched a program designed to speed up payments to rural hospitals. And on the surface, that might sound like a boring administrative change. But once you understand what's really happening, you realize this touches Medicare Advantage, provider networks, dental and extra benefits, access to care, and even whether your local hospital will still be there next year. Let's talk about why this matters. Right now, more than half of all Medicare beneficiaries are enrolled in Medicare Advantage plans. That number continues to grow every single year, and heading into 2026, projections show Medicare Advantage enrollment will keep climbing, especially in rural areas where premiums are often $0 and extra benefits look appealing. Dental coverage, vision, hearing, transportation, gym memberships, these things sound great, and for many seniors, they fill real gaps. But here's the part that doesn't get talked about enough. Medicare Advantage plans are run by private insurance companies, not the federal government. That means when a hospital treats a Medicare Advantage patient, it's not Medicare paying them directly. It's the insurance company. And that introduces something traditional Medicare doesn't have to the same degree: payment delays, prior authorizations, claim reviews, and cash flow challenges for providers. Now, if you're a giant hospital system in a big city, delayed payments are annoying but manageable. You have reserves. You have negotiating power. You have entire departments dedicated to billing and appeals. But if you're a small rural hospital, maybe with 25 beds and a skeleton staff, delayed payments can be devastating. Over the past few years, we've seen a steady drumbeat of rural hospitals closing across the country. Some close maternity wards. Some shut down emergency departments overnight. Others disappear entirely. And when that happens, seniors don't just lose a building. They lose access. They lose emergency care within a reasonable driving distance. They lose specialists. They lose continuity. That's the backdrop behind this new UnitedHealthcare pilot program. So what exactly is this program? UnitedHealthcare announced a 6-month pilot designed to cut Medicare Advantage payment times to participating rural hospitals roughly in half. Instead of waiting close to 30 days, or sometimes longer, these hospitals could receive payments in under 15 days. That faster turnaround gives hospitals immediate cash flow relief, helping them pay staff, maintain equipment, and keep services running. The pilot is currently focused on a limited number of states and hospitals, mostly independent rural facilities that are financially vulnerable. UnitedHealthcare says the goal is simple: reduce administrative strain and help stabilize rural healthcare systems. Now, let's pause here, because this is where people tend to jump to conclusions. Some people hear this and say, see? Medicare Advantage is finally fixing its problems. Others say, this proves insurers were sitting on payments all along. The truth, as usual, lives somewhere in the middle. This pilot doesn't mean Medicare Advantage is suddenly perfect. It doesn't erase prior authorization issues. It doesn't guarantee every hospital will stay in every network. It doesn't stop plans from adjusting benefits in 2026, including dental coverage limits and cost-sharing changes. But it does signal something important: insurers are feeling pressure. Pressure from hospitals. Pressure from regulators. Pressure from states. Pressure from seniors who are confused and frustrated when they can't find in-network care close to home. And pressure because Medicare Advantage is entering a new phase. As we move toward 2026, Medicare Advantage plans are dealing with tighter margins. CMS payment rules are evolving. Risk adjustment scrutiny is increasing. Extra benefits like dental are getting more expensive to offer. Networks are narrowing in some areas because hospitals are simply saying, "We can't afford this anymore." When a rural hospital leaves a Medicare Advantage network, it's not just an inconvenience. For a senior living in a small town, it might mean driving 2 hours for care, or paying out-of-network costs they didn't expect. So this pilot program isn't just about hospitals. It's about keeping networks intact. Now let's bring this back to real people. Think about Mary, a 72-year-old widow living in a rural county. She chose a Medicare Advantage plan because it fit her budget. $0 premium. Some dental coverage. Transportation benefits. On paper, it made sense. Her local hospital was in-network when she enrolled. But if that hospital were to close or drop out of the network because payments were too slow, Mary wouldn't just lose convenience. She'd lose access. That's why faster payments matter indirectly to beneficiaries. Hospitals that get paid faster are more likely to stay in networks. Networks that stay intact mean fewer disruptions for seniors. Fewer disruptions mean fewer surprise bills, fewer out-of-network headaches, and fewer last-minute plan changes during enrollment. Now, let's talk about dental coverage, because this connects in a way most people don't realize. Dental benefits in Medicare Advantage are one of the biggest selling points, especially going into 2026. But they're also one of the most expensive extras for plans to maintain. Many plans are quietly adjusting dental caps, narrowing provider lists, or requiring more pre-approvals. Why? Because every dollar spent on extra benefits has to come from somewhere. If insurers are struggling to manage costs on the provider side, especially hospital payments, those pressures eventually show up in plan design. That can mean higher copays, tighter dental networks, or lower annual maximums. So when you see a program like this pilot, part of what's happening is insurers trying to stabilize one side of the equation so they don't have to squeeze beneficiaries on the other side as much. Is it perfect? No. Is it meaningful? Yes. It also sets a precedent. If this pilot works, if UnitedHealthcare can show that faster payments reduce hospital closures, stabilize networks, and lower administrative disputes, you can expect pressure on other insurers to follow suit. And you can expect regulators to ask, why isn't this the standard? That's how change happens in Medicare. Slowly, quietly, through pilots and pressure. Now, I want to be very clear here, because this is important for trust. Faster hospital payments do not automatically mean better benefits for you next year. It doesn't guarantee lower out-of-pocket costs. It doesn't guarantee your dental benefit won't change in 2026. Medicare Advantage is still a pay-as-you-go system with copays, networks, and annual changes. But what it does mean is that insurers are acknowledging a real problem. And acknowledging a problem is the first step toward fixing it. For years, rural hospitals have been sounding the alarm. They've said that Medicare Advantage payment practices were unsustainable. They've warned that delays and denials were pushing them to the brink. This pilot is one of the first tangible responses from a major insurer that says, "We hear you." From a policy perspective, this also matters because states are paying attention. Several states have already taken steps to scrutinize Medicare Advantage networks and payment practices. When insurers act proactively, it can sometimes prevent heavier regulation down the road. Now, let's talk about what this means for you as a Medicare beneficiary heading into 2026. First, if you're on a Medicare Advantage plan and you live in a rural area, this is a development worth watching. It doesn't change your plan today, but it may influence whether your local hospital stays in-network tomorrow. Second, it reinforces why reviewing your plan every year is critical. Networks change. Benefits change. Dental coverage changes. And just because a plan worked last year doesn't mean it will work next year. Third, it's a reminder that Medicare Advantage is a system built on balance. Insurers have to balance costs, providers have to balance finances, and beneficiaries have to balance premiums against out-of-pocket risk. When one part of that system gets out of sync, everyone feels it. This pilot is an attempt to bring one piece back into alignment. Will it expand nationwide? That remains to be seen. UnitedHealthcare has said they'll evaluate results before deciding next steps. But even as a limited program, it's already sending a message. And that message is this: access matters. Hospitals matter. And timely payment matters. As we move closer to 2026, you're going to hear a lot of noise about Medicare Advantage. Some people will say it's broken. Others will say it's the best thing ever. The truth, as always, is more nuanced. It can work very well for the right person in the right situation, especially when networks are strong and providers are supported. Programs like this pilot don't make headlines like premium changes or enrollment deadlines, but they shape the environment you're living in as a beneficiary. So when you hear about faster payments to rural hospitals, don't think of it as an insurance company favoring providers. Think of it as a system trying, slowly, to keep care accessible where it's needed most. And if you're someone who values having a local hospital, a nearby emergency room, and providers who aren't constantly dropping in and out of networks, this is a development worth paying attention to. As always, the best thing you can do is stay informed, review your options annually, and ask questions. Medicare isn't set it and forget it anymore, especially heading into 2026. If this helped you understand what's really going on behind the scenes with Medicare Advantage and rural hospitals, leave a comment below. Comment your name and state so I can see who's watching and where you're from. And if you want to stay ahead of these changes, make sure you're subscribed, because we break this stuff down calmly, clearly, and honestly, without the hype. You deserve to understand the system you paid into your entire working life.